Hello, and welcome to this presentation on eponyms. My name is Rebecca Russano, and I've created this presentation for NUR 3874, taught by Dr. Beth Murphy. Eponyms is an application that contains definitions for 1,700 plus medical eponyms. It is available for devices that run either the Android operating system or Apple iOS. The Android version is free, and Apple offers a free version and a version that costs $1.99. There is no difference between the free and the paid version for Apple, but the developer asked for non-students to pay $1.99, and this charge relies on the honor system. The application is drawn from a database created and updated by Andrew J. Yee and can be used as a quick reference for medical professionals and the general public. The screenshot to the right shows the application's format, which basically categories within categories that the user navigates to retrieve the desired information. Eponyms is a very basic app. The information provided is comprehensive and only relevant when seeking the definition of medical eponym. The data should not be used solely to determine patient diagnosis and care. Having said that, Eponyms can be a handy app in a variety of healthcare settings, from a hospital to in-home care. The app is easily accessible and provides nurses with a quick reference which can help them better understand a patient's existing conditions or new diagnosis. This is especially useful if the condition is rare or uncommon. The information provided in this app, along with education experience, could assist in creating a healthcare plan or determining potential risks or complications. Eponyms is a useful application that should be considered by nurses as a basic tool in his or her digital toolbox. Nursing students will also find this application useful, especially in courses such as anatomy and physiology. This app eliminates the need to memorize obscure terms that they may only see once or twice during their education and training. Patients can benefit from using eponyms too. If a patient is interested in learning more about a health condition, this app can give them a broad definition of terms without the patient being subjected to an overload of medical language that becomes confusing and frustrating. Eponyms is extremely easy to use and navigate and has a very basic interface. The information is straightforward. This app does not require an internet connection, so once downloaded, it can be used to its full capacity, either online or offline. This application's main page consists of 3 super menus, all categories, favorites, and recent. Below those options, the information has been divided alphabetically into categories such as anatomy, biochemistry, cardiovascular, and so on. Each of these categories lists countless of eponyms, and with one click, the user is given a brief definition of the term. Along with this definition, the user is provided with a specific link to both Google and Wikipedia to find out more information. One downside of the app function is that there is no search bar on the main page of the app. The user must choose all categories or a specific category before being able to conduct a specific search. One particular pro about this app, though, is that there are no advertisements included. Considering the intended use for this app, the user does not have to contend with any major legal or ethical issues. However, there are some important points that need to be considered if a nurse chooses to use this app. The sources for the information provided in the app are not included. It is impossible to know if the information is legitimate. Wikipedia and Google are not considered reliable sources of information for healthcare. A nurse should use the information provided in this app only as a quick reference and consult a more reliable source before taking action. Patient privacy is not an issue with eponyms because no personal information is required to access any of the information provided in the app. An analysis of this app shows that there are both benefits and limitations. The benefits include the ease of accessibility for both Android and Apple users, the basic interface and navigation functions, the volume of information provided, the cost, and the convenience for acquisition and use. The limitations include the lack of trustworthy sources for the information and the potential for misinformation if using the links provided. Overall, I would recommend this app to nurses, medical students, and patients. In conclusion, this app is a free and easy tool for anyone interested in accessing the definitions to medical eponyms. Blogger Bethany Meyer states that the simple app Eponyms performs an equally simple function. It's a dictionary, derived from eponyms.net, of 1,700 plus medical eponyms. This app is a great tool for nurses and patients. Although the app lacks the notation of legitimate sources and offers links to websites that are not considered reliable, the app has its benefits. It is a great way for nurses and patients to access basic information and can eliminate the need for medical students and professionals to memorize hundreds of complicated definitions. Thank you.